Okay.
I'd like to welcome everyone to the Board of Health meeting. It is Monday, February 12th, 2024 at 6:02 p.m. And we will call this meeting to order. And roll call, Stephanie Granger here, Michelle.
Here.
Megan.
Here.
Sue.
Here.
And Joanne.
Yeah.
Wonderful, thank you. So we have our full board and we will go ahead then and begin with open forum.
I don't know if any of you have anything. Right now, participants, we have 0 participants. So there's no questions. A raised hand.
All right, well, seeing nothing, then we can move forward to the approval of the January 8th meeting minutes.
I had one small comment.
Okay.
Page 1 under community education.
Yep.
The ran out of test kits and has ordered more 1,000. 1,000 more.
I also think you might want to put COVID in there, ran out of COVID test kits, just for clarity.
Okay.
And then I had a couple other things, where it says proposition 2 and 1/2, we can probably delete the and doesn't need an and then on page 2, it says town of Action instead of Acton.
Okay.
That was all I caught, just a couple little things. Anybody else have any corrections?
I had the same ones you did.
Yeah, same.
Well, good. Our minute taker's doing a great job. Much appreciated. So is there a motion to accept the minutes with those small changes?
I'll make that motion.
Okay, motion made. Is there a second?
I'll second.
Oh.
We'll give it to Megan.
Okay.
Megan seconds. All in favor? Aye. So Stephanie, aye. Michelle?
Aye.
Megan?
Aye.
Sue?
Aye.
And Joanne?
Bye.
Okay. Motion to accept those minutes passes unanimously. Okay, so then moving on, we have a discussion on the memorandum of agreement regarding the PFAS multi-district litigation with a vote to be taken.
I think you missed the December minutes.
No,
we're not going to do them.
yeah, they're not on the agenda. We're going to discuss them next week.
Okay, thank you.
Next month. Excuse me.
Alrighty. So before you is a MOU that I should just start off by saying that there is a national settlement for PFAS, and Massachusetts is one of the states that's taking part in the settlement litigation. It's similar to opioid settlement funding. For instance, 2 of the companies, 3M and DuPont, have just settled with the litigation. We don't know for how much yet. We don't know how much is coming to our state or to our community. Westford is one of the communities here in Massachusetts that has signed on to receive PFAS funding through this litigation. Right now in Westford, we have about 25% of private drinking water wells. So talking with the Board of Water Commissioners, invited the health department staff to come talk to them about putting together some kind of agreement with the select board and the water department so that we can make sure that some of this funding is going to go not only to public water users, but to private water users as well. Right now, the funding that comes here to Westford and to Massachusetts do not have any requirements. So in other words, the funding could come in, the select board could decide, oh, well, we'll take that funding in and put it towards roads, it doesn't necessarily go towards water users. So this is something the Water Commissioner Board is looking to be proactive, and they wanted to work with the health department to see how we could work together and maybe put a program together. But again, we don't have any information yet, how much funding, again, and how that program would be put together to help private drinking water users. So they were hoping before they bring this in front of the select board for signatures that they could get the support of the Board of Health members on this agreement. They're very open to any suggestions or changes that you may like to see, or if you have any questions. But they are hoping to go next month, like I said, in front of the select board to see if they'll at least commit to making sure this funding goes both to the water and health department. So I'm happy to take any questions you have.
Okay, sorry. Let me look at that more carefully then.
So this is a draft.
Madam Chair, I have a question.
Stephanie?
Pardon? I'm sorry.
I have a
I'm reading and I
question.
can't do both at the same time. Yes, Joanne.
Okay. So Ray, I read through it and
Yep.
there's one section there that talks about the health department doing the, oh, I have to find it. Hang on. I've got my other
Is it-
computer open here.
Is it the section about us putting a program together in education?
Yeah,
Yeah.
and figuring out the percentages that go, are you part of that, figuring out which percent goes to the public water and which goes to the private? Because it seems like the health department is more in charge of the private drinking wells than the public. Is that
So
right?
the health department would be in charge, and the Board of Health members also oversee the regulations for private water drinking users only. So according to the water department, these are their numbers, the 75 and 25%, based on who they have hooked up to public water supply.
Okay.
So that's where that 75-25 comes from. That comes from them, which we're in full agreement with. The health department, and but our responsibility would be to figure out what the funding, where the funding would go, how much of the funding would go to private drinking water users. And certainly we don't know how much all of that. When we do have that information, it's very close. I guess they have settled. But again, we don't have that information. So once we do, we would certainly bring that here to the board. We would talk to the water department, water commissioners, and work together to see, what's the best way to either refund people or pay for PFAS testing, whatever those, whatever gets flushed out
Okay. And you're
with this
comfortable.
litigation.
As long
I'm
as
sorry?
you're comfortable with all of that.
I am. At first, I was concerned about, the responsibility of us, putting together, because we're not PFAS experts, right? And so the section that speaks to that the health department would put together procedures for distribution of funds for anyone who is eligible. I was just apprehensive of what their expectation was. But they do have here, it would be the Board of Health or town department to be determined, which would most likely be the health department in this case. And again, we would work with the water department to see what the best avenue is for that, getting that funding out to residents.
So just as an aside, I'm going to be attending a 2-hour seminar tomorrow afternoon on PFAS through New England American Industrial Hygiene Association. And so if I learn anything new, I can share that.
That would be great.
I think this looks great, and I think it's great that we're working together. We had the water department and discussions previously about new regulations regarding PFAS limited. Didn't have anything come through on that?
So right now they're waiting to see what the latest water requirements are through EPA, and they're supposed to get those late March. As far as, again, private drinking water well users, that would be that would fall into this board as to what we want to do. And I know we have brought to you, I think it was about 6 or 7 months ago, the water well regulations to see if we wanted to require any PFAS testing. I know at the time the board voted for recommendation only. And so that's certainly something that we've added to the regulations, but yeah, there's no requirement at this time. We do have the ARPA PFAS program, which has just started, And so that was $20,000 that was set aside by the select board with ARPA funding for 50 households. I think we went over that last month.
Yeah. Mhm.
So that's gone really well. That's open till the end of the month. I think we have a little over 75, is that correct, Abby, at this point, for applicants for that program from residents. So, and that's only been open a week and a half.
And to
Wow.
be clear, with that, the goal was to pick people from different areas so that you get a representative.
Correct. A nice
Um,
geographical. Yep. And so we're working with GIS and that and whatnot for those testing requirements. Abby and Sam actually already picked up those test kits. So we're just waiting till we close application process, and then we'll review to see where geographically we can let people know that they've been approved.
Is it possible to do composite sampling? So say you select a particular neighborhood, and rather than just test one household, you maybe test 12 and mix them into one sample. And then if it's clean, it's clean. And if
Mhm.
it's positive, then we would look toward, individual house testing. But you might cast a much broader net if you did composite sampling.
Yeah, it's certainly something we can look in. We've already signed a contract with our lab, in which case they've provided all 50 kits. We've picked those up, and the homeowner would be responsible to do that testing if approved.
Well, maybe if you get this litigation money, maybe that's something you could use
Correct.
it for.
Certainly
Yeah.
look into. Yep.
Yeah, I do like that idea. It's back to COVID. It's pool testing.
Pool
right?
testing. Yeah.
Which I like composite testing better. I don't know why
Yeah,
they didn't
yeah.
say it that way to not confuse people by saying pooled testing.
Yeah.
Especially when we're talking about water.
Yeah, exactly. We're
True.
testing everybody's pool.
Yeah.
Can you swim? No, but I think that's a great idea. That would be a good use of the money.
Mhm.
Okay, does anybody have any other questions about this memorandum of understanding?
Mm-mm.
No,
We're
as long
supposed to-
as
We're supposed to
As, you
take a
know, we're-
vote, though?
Yes, we should be.
you
taking
could.
it.
I just
So-
want to make sure that Ray, from the department side, that you're comfortable with it. You think you can handle that, and
We do,
That's
and-
all my concern is.
Yeah, I mean, at this point, it's very vague. And
Mm.
so not knowing, when opioid settlement funding came out, there was about a 12-page document of what you could and couldn't use the money for. That doesn't sound like the case here. Yeah, so I'm not sure what this is going to look like. They could say they give us $500,000 for private drinking water. How that's going to be distributed, that's going to take time to figure out that process. Like you said, whether we go with composite testing or reimburse folks, yeah, there's a lot of unanswered questions at this point.
Okay.
This is more just a, hey, excuse me, select board, do you mind when this money comes in to give this to us and to us kind of thing?
Yeah.
Yeah.
And I appreciate that
Uh-huh.
actually the water
Yep.
department was willing to share at 75-25 according to the distribution, because that is a very appropriate and helpful, I think, of them.
Agree.
Okay, I'll make a motion to, do we need to make a motion, or how do we vote?
So I would suggest that you make a motion to be in agreement with the draft memorandum of agreement between the Westford Select Board and Westford Board of Water Commissioners regarding PFAS multi-district. Yes.
Okay, all right. I will make that motion to approve,
Support.
support the memorandum of agreement between the Westford Select Board and the Westford Board of Water Commissioners regarding the PFAS multi-district litigation. Is there a second?
I'll second the motion.
Okay, Sue seconds. All in favor, Stephanie, I, Michelle,
Aye.
Megan,
Aye.
Sue,
Hi.
and Joanne.
Aye.
Okay, so we unanimously vote to support that memorandum.
Great.
Haven't silenced my cell phone. Okay, now I have. Okay, so then our next agenda item is the proposed updates to the Westford Board of Health regulations requirements for the subsurface disposal of sanitary sewage. Abby.
That sounds exciting.
It is exciting. Yep, so we looked over the septic regulations, just to do an update. They were last updated very minorly in 2019. So I don't know if we've all had a chance to look through the proposed. It's not a ton of changes, but it's just kind of things that, I've noticed have come up as issues. And we've talked to DEP in the past about some of these issues, and, the suggestion is always to put it into the local regulations. That way, we, have a basis to, go from if there's ever an issue or, for citations or anything. So I don't know if you, have any questions or concerns or anything, but let me know.
Anybody? Let's see. Anyone? Was that a hand on? Joanne?
Always me. Just a quick question, Abby.
Sure.
I only got to really skim it, but any of the new stuff, the sieve analysis was in there. There's a couple definitions. Was
Yeah.
that taken out of Title V, or did you use other towns?
Yeah, so actually that comes from a document that there's been some uncertainty with the interpretation of, and that's why we wanted to put this in here. So there's a document for repairs only from DEP. It's a guidance document called Title V Alternative to Percolation Testing Guidance for System Upgrades. And that is kind of outlining what to do when you can't perk, like if it's too wet. So in that document, there's a section this is taken out of, and it's under a section that you would not think it would be for class 1 soils. So it's under like all compacted soils and class 3 and 4 soils. So speaking with someone at DEP, it does really seem like it would fit to be into about class 1 soils. And that's kind of why we're putting it in here, is to encompass a lot of the sieve analysis that come back as, let's say, 90% sand. But according to the DEP document, if it's not compact soil, like it's not wet or something, then that would just be a 4-foot groundwater separation rather than 5 foot. So we feel it would be conservative to give you, a 5-foot offset. We just feel more comfortable with that. So the document's not super clear, but that's why putting it into our local regulations, we feel that it would provide some clarity.
Do you get a lot of sieve analysis instead of
It not a lot, but it's
enough?
been a very wet year, so enough. Yeah. Enough that this is a frequent kind of issue that we encounter. So it would be helpful to have it in the regulations.
With the groundwater as high as it is right now, is that really impacting septic systems and such?
It's definitely affecting our soil testing, I would say. Yeah.
Any other questions for Abby? Ray, you like this too?
Yeah, so we have gone on over this almost a little over a month now. Abby's been working with Sam. We've met all 3 of us about questions, concerns, changes. And we have reached out to Claire Golden at DEP, who is our contact there regarding that section and some others. And they're in full support.
Michelle, any comments or questions?
Nope,
No, I
nothing
should-
to add.
I should say that, a vote tonight won't be needed. We do, as septic regs go, we would need to have a public hearing. So
Okay.
we'll put that on for next meeting. We just want to make sure you had a chance to look at it. Just have a discussion, and certainly that way too, you'll also have another opportunity to take a peek at it. Mhm. Yep. And what we usually do is we will send this out after tonight. We wanted to check with you to see if there was any big changes or concerns. We do send this out to our listserv of installers and engineers and, get their feedback
Okay.
so that they're aware of the public hearing, because certainly this affects them and their clients. There aren't that, and forgive me, Abby, but there aren't that major changes or anything earth shattering.
I wouldn't say anything earth shattering. No, just a little tweaks and stuff like that.
No, but that's great that, that they're notified, because otherwise they might not realize there are some changes, so. Excellent, okay. So we don't need a vote at this time, but it will be put on as a public hearing for next
for next meeting.
Okay.
Can I ask one more question?
Yes, please, Joanne.
But I was just trying to flip through it, and was there any changes or is there anything in there about grease
We didn't add anything about grease traps, though.
traps? Grease traps. Wait, I'm thinking of it and I can't say the word. You know, we had that issue with the restaurant with the internal grease trap and going into the septic system.
Mm.
Yeah, so nothing's changed in that section.
No, I mean, we could add something if you have a suggestion, definitely. We're still open, to any changes or modifications. I kind of felt like with that one, I mean, the plumbing code handles the internal, we handle more the external, but if there's something, yeah. So,
No, I'm just flipping through it too fast to catch it. So I just thought I'd ask.
yeah,
Okay.
no, that's a good point.
The section on the water softener filtration systems, is that fairly similar to what it has been, or is that a change?
Yeah, this is another case of adding something into our regulations that it's like kind of a practice and policy that we do in the department, but this is putting it into writing, so we have actually something to point to and say, this is the reason, rather than, oh, this is how it's always been,
Mhm.
so, yeah.
That's good. That's great.
Yep.
Yeah, we typically make a list. So the staff will make a list as things are coming up over the years,
Yeah.
and then, every 2 years we kind of, okay, we got to go in to make some upgrades to the local regulations and some changes and bring them up to date. So that's what we do. We kind of look at our notebook of things over the years that we're noting. So
For example, the vent with the property line, I know that's a rule that the board has determined, and now it's in here to have some,
And
more legal
10
teeth.
days on your as-built review is plenty?
Mhm.
Okay. Just remember we had some busyness going on with that for a while, so
Yeah.
you feel that's sufficient time.
Yeah, I think so for as-built, yep.
Okay, great.
thank you, Abby.
Yeah, thank you, Abby.
No problem.
All right, so we have an update on the Health Department FY25 budget next.
Yeah, so I just wanted to keep you up to date. 2 weeks ago, I met with the finance the finance committee and select board members for their joint meeting. We were on first, actually, which was quite nice, on their meeting regarding the budget for FY25. So they did have a bunch of questions, certainly, and that was recorded on WestfordCAT. But I would say overall went very well. They asked about regionalization, if we've investigated, coordinating with any other health departments. They also asked about if we've met with the town manager or with any folks about possibly consolidating, whether that's staff or our departments for a health and human services division. So we did let them know we did meet with Kristen, our town manager, just to initially just talk about. We met with the Council on Aging, the health department was there, and community wellness. I did also remind the select board and finance committee that this board has consistently from the beginning made requests that community wellness fall under the health department. But we're just kind of waiting to see what gets approved or doesn't get approved. They asked a lot about our school dental program, and that was pretty much it. I know that some of you saw it on WestfordCAT. I just didn't know if you had any questions or concerns.
Well,
We
I
do have a
mean,
meeting at the end of the month with the town manager to continue to talk about possibilities of consolidation. So I don't know if that's going to look like yet.
Sue?
I was listening to the meeting. I didn't speak up, but because Ray did such an exceptional job and there really wasn't anything to add. But what I found kind of a little comical is that there was one comment about how much you're doing. Like it's almost like the health department is doing too much. Wasn't that one of I think it was Christina, somebody had said, like, because it was an impressive list of what's being done. And that seemed a little ironic to me, that there would be a comment about you guys are, doing too much. To me, it's like, it should be impressive for what you're doing for the town, not too much, but impressive. So that struck me. But anyway, but excellent job. really.
Was that a select board member or a finance committee member?
With finance.
Okay.
What? Yeah, that's an interesting.
Hmm.
Yeah.
We are very
Stop
pleased
being
that our
good.
department does a lot.
Yeah.
We appreciate it.
Yeah, no, yeah. No, it wasn't I mean, it was a compliment, it was
Yeah.
just, I thought it was kind of funny that like, yeah, it's good to be recognized too, right? It's amazing all that is being done. It is very impressive when you see the list of accomplishments and all the grants that you've secured. And I mean, it's very impressive. So,
Well, thank you.
It's public health in general. Oh, you do that. Oh, you do
yeah.
that.
Yeah, exactly. Yeah.
I will put myself out there in case that you, Ray, or Stephanie need more support on keeping the health department separate, not whatever plan they're coming up with. Excuse me, I have a cold. Having
You
been
sure
doing
it's not COVID? Sure it's not COVID?
no, I tested. Um, okay, knocked right off.
Sorry.
But in any case, I've been doing this a long time and I've seen all different iterations of health departments. And I can tell you what works and what doesn't work. And the health department should not be under anybody else. And I'll be happy to attend meetings or whatever. If you need
Thank
more
you,
support
Joanne.
on that.
Yeah, you would be a good voice, Joanne, especially with the role that you play. Yeah.
Thank you.
Just not right now. I can't talk.
Okay. Yeah, so
That's it. Yep, for the
Thank you.
budget.
Thanks, Ray.
Yep.
We're here with you guys on that. All right, so the next agenda item is new business.
Okay, so just a couple of announcements. So Tevin Wooten, who is a meteorologist with NBC Boston, he is coming to Westford to put on a presentation for residents with the health impacts of climate change. This is something that has been really important for residents out of our community health assessment is health impacts with climate change. So I know Harvey Leonard was just here a couple of weeks ago through another group, which we weren't aware of, but Tevin is fantastic. He's talked to the nursing group here for the chapter from MAPHN. So I don't know if Joanne heard him, but I heard he was fantastic. So he's coming next week, and I just wanted to make sure you saw his flyer. He is here during the day because he works at night as a meteorologist. So, but he will be recorded on WestfordCAT, so we'll be able to share that with the public. And I heard he's a very engaging speaker. So Gail worked really hard, our public health nurse, in getting him back.
He was excellent, and he had a great way of tying in the science with public health and just making it very easy to understand, because a lot of the climate change stuff can be very complicating and scary. But he was a great speaker, and I learned a lot, considering this is kind of what I do too. So he was really good. Yeah, I'm glad he's coming back.
Yeah, that's great.
So that is that event. And so that is February 20th, 9:30 to 10:30. And so that flyer is part of the packet and has been advertised. CPR, AED, and choking. Gail's flyer was also in your packet. I just wanted to let you know this is the first series, the first time we're charging for CPR classes. So to make sure we're at least not really covering our costs per se, Gail is already working, so it's no cost there, but to cover the materials. In the past, we've had grants through the MRC, and so now we're charging for, it's $20 if you want the card after you take your CPR class, your Heart Saver, and it's, I think, $3 for the book. So we make $1 or $2 off each person that signs up. So I know the Road and Bush and the rec department also have CPR here in the community, and I think they charge $90 a person. So this is a real bargain. So this is part of an initiative to make sure we're, at least covering for materials. So So that is taking place 6 to 9, and that's at the Millennium School, and that's on February 28th. All right, and then I just wanted to make you aware in a new business, Nancy Barnes, who is our Upper Merrimack Valley MRC coordinator, who handles over 690 volunteers here in our region for emergency preparedness. She did bring in another NACCHO grant, which is listed here, the National Association of County and City Health Officials. So we're so grateful to her. She works so hard. She brought in another $10,000, which will help towards older adults, fall prevention, education, and assistance programming. So that letter was in your packet. We did receive an FDA grant for a little over 17,000, and that's going to help our department adopt the 2022 food code. Every 4 years, the food code nationally is updated. Massachusetts is behind 2 codes actually, but our health department strives to work a little bit harder, standard a little bit higher. So it's a little bit easier for our establishments if we keep up with the code changes. It's not such an impact for our food establishments to jump from 2 or 3 codes. So there are minor changes, and we'll certainly provide all that education, but this funding is to bring in a consultant to help us do that. So we're excited about that grant. Emergency preparedness training for people with disabilities. So during COVID, this is a free service through the Office of Disability in Massachusetts called MAUD. And so they'll actually come out and they'll provide a training for anyone who states they have a disability. You don't have to ask them what kind, it doesn't matter what kind. But they put on a 45-minute training. They go over like apps and different services and all kinds of things to help anyone out that, there's a registry that you can sign up for so that if there is an emergency and you need some assistance, you can get at a registry. So they go over all that, but they give you a 72-hour kit with hydration, water, and all kinds of things. There's over $100 worth of stuff in it. And it's free. So we brought them in during COVID, and they're coming back, and they're going to bring 45 kits for anyone that attends. So that'll be great. They'll put on the presentation, you'll get a free kit. And that's something that Brittany Nash is coordinating. So that too is also in your packet. And I think that's everything for new business, if you have any questions on that.
I don't have any. Does anyone else?
Mm-mm.
Great stuff, Ray. And great thanks to Nancy for her continued hard work there.
We wouldn't be here without Nancy, that's for sure.
Yeah.
We need her.
Okay. So seeing no comments, we can go on, I guess, to the old business, which we already go over the per and poly?
Yeah, we just wanted to let you know that we've had quite a few residents sign up, which we're excited about. And that will again close at the end of the month, and then we'll start the process of reviewing all the applications. What's kind of neat too is not only will folks have an opportunity to have their well tested for PFAS, but everyone that applies, we're pulling all their well data information and having that put on GIS. So which will be nice to be able to see how deep wells are, what kind of well, and what kind of testing that we have available.
So sorry, just for the neophyte in the well arena and understanding that you have their well data, but not.
We don't have everyone's well data. So some people's well might have went in, 50 years ago, and it might be a dug well. Some people have a drilled well where you see the wellhead sticking out of, the front or back of someone's property. But there's several different kinds of wells. And so we do have a big mix here in Westford. Some are 800 feet deep and some are, 50 feet deep, depending on
where is that depth found? Like, do you have that data in the department?
Some of the data we do have, and some DP has. There are some properties that we have no data for. So, some we have well completion reports. So, but each person that applies, we pull the file, we see what kind of information we have. And right now we're building profiles on each well so that we can put that on GIS. So that if we do have the information, it'll be nice to see, okay, who's got what and who's tested and
Okay,
how
so
deep
for
their
different
well is.
areas, you may or may not have that information. available.
Correct.
Okay.
Correct. Yeah. So that's PFAS.
Okay. And then
And
the
the,
health ins-
yeah, I just want to let you know, I know we've talked about the regional health inspector position. The town manager does have a hiring freeze that was instituted last week. I did talk to her about this position, and she's approved us to advertise because it is grant funded, which is exciting. So the consultant that we work with, BME Strategies, has put together this position's job description, working with the coalition, Northwest Coalition, which Westford sits on. So we're excited about the position as listed, and that went out on Friday.
Okay, have you been
The
receiving,
advertisement.
are you,
It just
who's
went out
reviewing
Friday,
it?
so I haven't heard of any applicants as of yet.
Okay,
And
And
why
usually
is the person going to be based in Westford?
Because we're the host agent, because we're the host agent and with this particular position, our hope is that, working with the group each day of the week, a person would, so one day they'll be in Acton all day.
Okay.
One day they'd work in Westford. Fridays, most health departments, not Westford, but most have either a half a day or they don't work Fridays.
Oh.
So we figured Friday they would be hybrid, work from home. For instance, Brittany's position, she works 2 days from home. And we just don't have the physical space in the
Well,
department.
that's what I was thinking. Like, where are you
Yeah.
gonna house the person? Yeah, when I saw
Right.
that, yeah. Yeah.
So they'll use a shared space, one day a week in Westford. That's the hope. So
great. And are you the one who's doing the hiring? Is that you because you're the,
all 4 directors will have an opportunity to decide if they want to be part of the hiring process, the interview process, and the training process. Because you can imagine 4 different departments, they all train differently, they all operate differently, they all have different regulations, and they all inspect differently, have different forms, some electronic. So it'll be interesting.
the
But it does seem like
flexibility
it's,
mentioned is going to be critical for this person.
but I will say, and I think Joanne is aware of this as well, is that there's been some great successes with regional inspectors. So it does appear to be working well in other parts of the state, which is exciting. I know it's a new challenge for us, but it'll be nice to have the extra help and to have someone to go into establishments and provide education and that kind of thing. So
Great.
So oh, sorry.
Go ahead, Joanne.
Where Lowell is in inspectional services, how is that gonna play out with the health
right. So
department? 'Cause they
with
don't
Lowell,
inspect.
yep. So I did reach out to the gentleman. His name is Lloyd. I don't have his last name in front of me, but he oversees all of the inspectional services now for the city of Lowell. And so I have been working with him not only directly, but through our coalition to let him know that all of the opportunities that are available for their inspectors. I know some of them he's taking advantage of and some of he's not. They have a little different system where, for instance, this regional position will not be able to go out on their own in Lowell due to union rules and regulations. So the person will need to shadow with an actual employee in Lowell.
All the
Which is
time?
a little different. Yep. According to Lowell. Yep. So, but they do state that they need someone to shadow and help them with housing cases. They're out on housing cases every day. And they have a policy where 2 people have to be at each inspection. So they'll be able to utilize the regional inspector that way.
Yeah, that makes sense on housing. Yeah, okay. What are the other positions? Have you
The
already-
only
so
other
this is a
position,
new one, right?
This is a new one. Yep. So
Okay.
Brittany is still in that group. This will be a new position. And the next one to roll out in the last one for this year is a licensed social worker.
Oh,
They
that
call
would
it
be
a public
awesome.
health specialist,
Yeah.
but it's a licensed social worker. And I've been working with the schools to see what kind of assistance,
That's
if they need
awesome.
any assistance
Yeah.
with
Yeah.
additional help with the mobile clinician and that kind of thing. So,
Good.
Well, I'm sure Alice and Christopher could use some help. You
yep,
know,
we have
yeah.
reached out to her. You know, it's
Yeah.
one of those things that there's a lot of those questions now with the budget, and you want to make sure you don't get in anyone's lane, but you offer services that we need. And so, yeah.
I think a lot of people think that Alice and Christopher is just for the elderly, and she's not. She's a town social worker. So I think if people were more aware the fact that we even have a town social worker, I think she'd be even busier than she
Mhm.
is. Yeah.
Yep, I agree.
Great, Ray. Thank you.
Yep, sure.
Is there any other old business that anyone has?
You want to see my granddaughter?
I don't know if that's old or new business.
There she is. Look at that
Oh,
face.
she's a doll. She's so cute. Look at those curls. Cut it
Dimples,
I
out.
know. Isn't she cute? Yeah.
And those
Uh,
cheeks.
She's
My
a cutie
God.
pie. I know. Yeah. Yeah.
It's
Anyway.
the dimples.
Yeah, the
It's
dimples.
dimples.
Yeah, Abby can relate, right, Abby? How old is your little girl now?
She is 6 months and 2 weeks.
Oh my God. Yeah,
Right.
Shay is 4 months. Yeah. Yeah.
Yeah.
Oh my God, she's so cute.
Goes by fast, huh? Yeah.
Oh, yeah.
So anyway.
All right.
Anyway. Well,
We don't have anything else. We can have a motion to adjourn. That was the highlight of the meeting. Thank you.
I couldn't resist.
All right. Were you
All right.
making a motion to adjourn?
Yes, I was. Yeah. I'm
Is
not
there-
good about raising my hand like Joanne is. I'm so sorry. Yeah. Only to adjourn.
Catholic school.
Exactly. I did too, though. Yeah.
Was that a second, Joanne?
Yes.
Okay. Motion made and seconded. Stephanie, I. Michelle,
Aye.
Megan,
Aye.
Sue,
Aye.
and Joanne.
Aye.
Thank you, everyone. And thank you, Abby and Ray.
Yeah.
I
You guys
appreciate
are awesome. Very proud to work with you guys. Honestly, you do a great job.
Thank you.
Yeah.
Well,
Thank
have a
you.
great night, everyone.
Good night, everybody.
Be
Stay
safe.
safe
Thank you.
tomorrow.
Safe tomorrow. Stay safe.
it.
Bye.
My husband
Don't
said
go
they've
out.
downgraded the storm. So
Of course they did. Flights are probably going out tomorrow, but now I can't get out till Thursday. Oh well. Good problem.
all right. Good night.